This conference will now be recorded.
Welcome in, everybody. On today's lecture, we are going to be talking about submersion incidents, which is going to be chapter 25 in your guys' textbooks. So when we're looking at water-related emergencies, submersion incidences, we got to be thinking of the geographical area that we cover as far as our primary service area. Now, within the Duluth Superior, Cloquet, northern Minnesota, obviously we have a ton of lakes. As a result, we have a lot of individuals who do boating. A lot of individuals do scuba diving, especially in Lake Superior. There's water skiing, what have you, a lot of different elements as far as how people enjoyed their time in a recreation aspect in regards to the water. So with our water-related emergencies, what we're going to cover is we're going to cover swimming, scuba diving or deep water exploration, diving, boating, and then also water skiing. So when we're looking at drowning, drowning is an incident in which someone is submerged or immersed in a liquid that results in a primary respiratory impairment. So we do have a couple of different elements as far as active drowning and passive drowning. Active drowning is when they are no longer able to breathe. Passive drowning is they're still able to hold their head above water and actually get air in. But when we're looking at this as far as the morbidity and mortality statistic, 4,500 deaths per year for drowning related incidences. And this is the third leading cause of accidental death. After motor vehicle accidents is going to be the first one. So when we're looking at this too, when we're breaking down that age group, in between 1 and 4 is actually the leading cause of accidental deaths. So then when we're diving deeper into our statistics and data, so 40% of these 4,500 deaths per year is going to include children less than 5. 85% involves males, and oftentimes when we're looking at the adult and or the adolescent statistics for drowning, alcohol is a huge factor, especially within males. When we're looking at that age group, oftentimes they find themselves invincible. Alcohol is going to be a factor, and then they try and go swimming at night or go swimming without anybody else around who can actually monitor them. So there's even more statistics. Again, it's a very, very common occurrence where you will actually respond to an active drowning or a passive drowning victim. And as far as the pathophysiology behind this, so once water starts getting into the lungs, then that individual is not able to breathe because they can't take that oxygen in, but then also that water is sitting in the bottom of the lungs, and once they start to get their head above water, it's very difficult for that individual to actually start getting oxygen into the system because of that hindrance of that water in the bottom of the lungs. And as a result, it really encapsulates that alveoli factor. So other contributing factors for drowning, low blood sugar is also another one. So when somebody who is diabetic is swimming, this is a very physically exhausting activity, and it can actually drop their blood sugar quite a bit. Then we can see the list of others. The big ones within our area are going to be hypothermia, any alcohol or drug use, also trauma, especially if somebody dives in at the end of a dock or into a pool and it's not deep enough and they end up getting some type of central spinal cord injury. So stages of drowning, first something goes wrong. Either they get caught in a rip current, they go out too far, they jump in and realize that it's deeper than they thought. Next is that panic is going to set in. So that individual is going to go into a fight or flight response. And as a result, they're going to drop all their adrenaline and testosterone inside their system in order to try and save themselves, which might be a hindrance here, because when we go into that fight or flight response, oftentimes we start to shunt the blood away from our extremities and our skin. And especially in our area, with that water being so cold, it actually hinders that individual's ability to stay warm, especially in those cold waters. Next, we have inefficient breathing. and with the water coming into the system, that results in a decreased buoyancy, because naturally we're relatively buoyant. Where individuals who are not buoyant is very muscular individuals. So a heavy amount of muscle mass, muscle sinks, fat floats. Next, they're going to get in the exhaustion phase, so their fight or flight response. All of that adrenaline in their system has basically failed at this point, and they're going to start deteriorating. Then that individual, if they're not pulled out, is going to go into cardiac arrest due to, remember, our H's and T's. This is going to be from hypoxia from that drowning incident. So then our predictors, as far as chance of survival goes, for somebody going into cardiac arrest from drowning, is if they have 3 or more of these present, the chance of survival is about 5%. So 3 years of age or older, submersion time was greater than 5 minutes, and resuscitation did not begin for more than 10 minutes after rescue. So those 3 factors are really going to hinder our ability to actually resuscitate that individual. However, if that individual is greater than 3, they were pulled out of that water soon, and cardiac arrest management was addressed relatively early, then that chance of survival is quite a bit higher. Especially somebody in a cold water related event, oftentimes that body shuts down properly, so it actually saves the brain based on how cold that individual is. Then here is a YouTube video based on the pathophysiology of somebody drowning.
Went for a bike ride down to the waterfront and was just hanging out, relaxing on a bench when it happened, when it all went down.
I think I should call 911. Yeah, call 911. Call.
He was trying to swim to a dock, which was, I don't know, 50 feet out from the shore. I noticed he wasn't a strong swimmer. I was concerned, that he wasn't going to make it to the dock. And that's when he pretty much stopped and was sort of started to flail. And that's when I jumped over the rail, took my clothes off, and jumped in. That was it.
Some guy's drowning down here at
I really was trying to keep his head out of the water. I don't think he had much strength left. And like I said, I just tried to turn him on his back and try to keep his head out of the water. But I was having a lot of trouble keeping my head out. I realized the only way I could get him to shore was if I just separated myself and used his jacket and just swam with him that way. So his head was underwater, so I knew as soon as I got to shore that he would be unconscious and probably not have a pulse, because it was, at least 2 minutes swimming to get to the shore.
Oh my gosh, this guy's passed out. We need somebody here right now.
One guy helped me pull him up, and I started chest compressions. I checked his pulse and just started CPR. I think it was just one of those situations where you just sort of on instinct, and you just know what has to be done, sort of. Like, I just knew I had to get to that guy. I feel thankful that I could help him out, and I was in the right place to be of assistance.
So that was a great video of seeing those different stages of drowning, that first initial something goes wrong, followed by panic sets in, and then we can see that that individual was losing the battle towards the end. So luckily, that one person who dove in was ready to go. But diving deeper into that pathophysiology is that larynx is going to spasm. As a result, hypoxia is going to set in. And then because we're not able to get rid of that waste from cellular metabolism, our carbon dioxide level is going to increase pretty drastically. Then we have a hindrance within our capillary gas exchange because of that alveoli, and that surfactant is going to fail. Whenever we have an individual who's drowned or drowning, we always want to take C-spine precautions. Because A, a lot of times it's from diving incidences, and then B, we don't know what kind of trauma actually occurred underneath the surface of the water. Because people can bang around down on the bottom of the lake or the bottom of a pool. So our rescue options when we are utilizing this is think of what we are trained to do. So as EMS providers, oftentimes we're not actually going to go into the water. This is going to be conducted by a fire department or a rescue department who is specially trained in water rescue emergencies. But our hierarchy, as far as what we should utilize in order to try and get that individual out, is first speak. So talk to them, try and guide them to the edge of the pool or the edge of the lake if you can. Next is reach. So if we're on a dock or if we're on the edge of the pool, if we can reach something out to them, try and do that. Be careful about actually extending your own arm and grabbing them, because oftentimes your would-be rescuer is actually going to get themselves into trouble because they get pulled into that water, and then as a result that person actually drowns their would-be rescuer. Next is throw. So life rings, any flotation device. Next, row. And then lastly is go with assistance. And it's always best to be tied off to the edge of the lake or the edge of the pool with this. So with resuscitation, back to our cardiac arrest algorithm. So this is what I was mentioning earlier when I was talking about the survival likelihood because of the body protecting themselves in cold water. So the mammalian diving reflex is a reflex from cold water that drastically slows down metabolism. So when it slows down metabolism like this, it results in that individual not needing as much oxygen in order to perfuse properly. So they can use their stored oxygen levels inside their system to actually continue to perfuse for an extended period of time. Any drowning patient should be attempted for resuscitation, and it's because, remember our old rule, you're not dead until you're warm and dead. So these individuals are going to be cold until we can actually deem them a DNR or unable to resuscitate at that point. So there, all the different sensors and how our body is going to respond to those. So we can see the mammalian dive reflex sets in, and as a result, it drops our respiratory center, our cardiovascular center, and then basically it protects everything as a result of that individual going down. So signs and symptoms after we pull somebody out, you can see asymptomatic or symptomatic. So first cardiac arrest, then obviously dead. Other signs and symptoms that we're going to see is somebody nausea, vomiting. We're going to have to be aggressive on the airway treatments for that because there's going to be a heavy amount of water that's going to be coming out of that system. So then our basic laws. So this is going to reflect on our submersion incidents and then also our diving. So our baryism, that's the effect of the body of changes in the ambient temperature. Boyle's law, when pressure increases, the volume of the gas decreases. Pressure decreases, the volume of the gas increases. So it's like a teeter-totter effect. Dalton's law, the total pressure of a mixture of gas equals the sum of the partial pressures of the individual gases that make up that mixture. Then Henry's law, the amount of gas that's dissolved in a liquid in contact with a proportion to the pressure of the gas around it. Charles' law is all gases will expand equally upon being heated. So there we can see the different pictures of those gases. Not super important that you remember all these laws. They really dive deep into scuba diving when you are getting your open water diver certification as far as all these different laws, is because this exactly replicates of what's going on inside the body when you do dive. So then our specific emergencies when we are looking at somebody in scuba diving, first is decompression sickness. And this is going to be a result of nitrogen in the blood and tissues. So nitrogen is going to enter inside of that individual's body when they are scuba diving. And it's very important that they take a few minutes when they're descending to allow for that nitrogen to be absorbed through the body. And then when they're ascending, they have to stay at a certain level for an extended period of time in order to get that nitrogen to actually dissolve out of the system. Or we run into issues is if they ascend rapidly, and that's a result of that nitrogen actually being trapped inside the tissues, and it can cause obstruction within the emboli. And then they also stretch the blood vessels and the nerves. So with that, we have two different categories. We have type 1, which is mild. So if it's somebody ascended just a little bit too quickly, they could have some mild signs and symptoms, which are going to be pain in the joints, maybe some shortness of breath, a headache, maybe some disorientation. Type 2 is serious, and oftentimes that is going to be a result of an altered mental status change as far as going to an unresponsive state. Then we also have an arterial gas embolism as well. So again, that person goes much too fast, and then they end up with that nitrogen bubble, and it causes an embolism. So as mentioned before, they're going to see pain, oftentimes in the joints. You can see itching and burning sensation of the skin. Again, that's going to be a result of that nitrogen being trapped in those skin tissues. Pictured, you can see that skin rash as well. So basically those blood vessels that were being described burst at that point, and we can see the bruising and the skin rashes. And then some very rare or uncommon signs and symptoms that we might see, an orange peel appearance, I've never seen that before, or painless pitting edema, or basically that individual's lost some of the components underneath their skin, so that when you push down, it doesn't embark at all. So then some additional signs and symptoms when we're looking at our type 2 or our serious decompression sickness: low back pain, headache, nausea, vomiting, signs of hypovolemic shock, and then we could see rales, cyanosis, and then obviously cardiac arrest. With an arterial gas embolism, so this is going to be a blockage within one of the blood vessels by an air bubble or a cluster of the air bubbles. So an individual could have chest pain, coma, cardiac or respiratory arrest, nausea and vomiting. Oftentimes we'll see an arterial gas embolism with somebody who is scuba diving, and then they immediately get on a plane and fly afterwards. And that change in that altitude really plays havoc inside the system with those different gas bubbles inside the system. So as far as what we're going to do, as far as emergency care, always consider C-spine stabilization. We have to be aggressive with our airway, breathing, circulation treatment, provide any oxygenation, and then also transport immediately. All right, that ends it for our submersion and drowning incidences. Thanks, guys.